All right, let's get into it. Today, we're going to demystify a procedure that has, no joke, given millions of people their lives back: hip replacement. Our whole goal here is to take what seems like a really complex medical topic and turn it into a simple, clear journey for you, from the day-to-day grind of chronic pain all the way to the freedom that comes with relief. You know, it really all starts with this one big question, one that so many people wrestle with every single day. What does it actually take to get your life back from the grip of chronic hip pain? Because it's a pain that doesn't just hurt your body, right? It can make your entire world feel smaller. And that's the question we're here to answer.
For so many, this is where the story really begins. It's that point when hip pain stops being just an occasional annoyance and becomes this constant thing that kind of dictates every single part of your day. So let's talk about the reality of that pain. So, do any of these sound familiar? We're not just talking about a few aches and pains here. We're talking about that relentless pain and stiffness that turns something as simple as walking or climbing stairs into a massive challenge. And when that pain is still there, even when you're just sitting and resting, well, that's a huge sign that it might be time to think about a real solution.
But the good news is, there is an incredibly effective and well-established solution. So let's dive in and really understand what hip replacement surgery is all about.
The best way to think about it is like a high-tech restoration project for your body. The goal isn't just to cover up the pain. It's to go in, precisely remove the damaged, worn-out parts of your hip joint, and then replace them with brand-new, durable components that are literally engineered to give you back that smooth, natural movement.
Now, this isn't a one-size-fits-all kind of deal. As you can see here, there are basically two main paths, and it all depends on how much damage there is. A partial replacement is for when just the ball part of the joint is the problem. But if the damage is more widespread, a total hip replacement rebuilds both the ball and the socket for a complete overhaul.
So what are these new parts actually made of? Well, they're not just bits of plastic. We're talking about highly engineered prosthetic components. They're crafted from some really advanced materials, things like special metal alloys, tough ceramics, and super high-grade plastics, all designed to work together and function just like a healthy, natural hip.
Okay, so let's walk through the procedure itself, because the modern way of doing a hip replacement is really a safe, precise, and super personalized process. It's all designed to give you the absolute best result possible.
The whole thing really follows a very clear, patient-focused plan. It all kicks off with a detailed assessment, using imaging and exams to figure out the perfect approach for your body. Then, in surgery, doctors often use amazing technology, like computer-assisted tools, to get incredible precision. And all the way through, modern pain management is a huge priority. And your guided rehab program starts almost right away to get you moving again.
And after the surgery, well, that's when the most rewarding part of this whole journey really begins, your recovery. This is where you actually start to reclaim that active life you've been missing out on.
You know, recovery often happens a lot faster than people expect. I mean, within just a few days, you'll probably be up and walking with some support. That big milestone is usually somewhere between 6 and 12 weeks out. That's when you're getting back to most of your normal daily life. And beyond that, the goal is simple: an active, pain-free life.
This quote just hits the nail on the head. It perfectly captures what this is all about. It's not just about fixing a joint in your body. The real goal is to give you back your confidence. The confidence to take a walk, to play with your kids or grandkids, to live your life without that constant thought of your hip in the back of your mind.
Okay, so I'm sure you have some questions rattling around in your head, and that's totally normal. So let's just tackle some of the most common and important ones right now to make sure you have the clarity you need.
This is a big one, probably the #1 question people ask. They want to know, is this a permanent fix? You know, how long do these modern implants actually hold up?
And the answer is pretty incredible. Thanks to huge leaps in materials and engineering, today's hip implants are expected to last for 15 to 20 years, and honestly, very often much, much longer. This is absolutely a long-term solution.
Okay, next up, let's talk about the practical side of things. How long does it really take to fully recover?
So just like we touched on a minute ago, that key window for a full recovery is generally somewhere between 6 and 12 weeks. That's the really crucial time for working with your physical therapist, rebuilding your strength, and getting back your full range of motion.
Now, it's also really important to be realistic and to acknowledge that, just like any surgery, there are potential risks involved. So what are they?
The main things doctors keep an eye out for are infection, blood clots, or the new implant loosening up over time. But, and this is a really important but,
Modern surgical procedures and protocols are specifically designed to minimize these risks, which makes this a remarkably safe and reliable surgery for the vast majority of patients.
So as we wrap this up, I want to leave you with one final thought. Just for a second, forget all the clinical details, all the medical terms, and just imagine it. A life completely free from that nagging, limiting hip pain. What's the very first thing you would do? Go for a long hike? Get down on the floor and play with your grandkids? Get back to a sport you used to love? That, right there, that's what this journey is really all about.